Welcome to the deep dive. Today, we're exploring something really fundamental to staying healthy as an adult: the recommended immunization schedule for the United States. Our main guide here, it's the official 2025 recommendations from the CDC and ACIP. And look, this isn't just some dry list of shots.
Not at all.
It's really more of a dynamic guide, right? Designed to help you and your healthcare provider figure out the best way to protect yourself. So our mission is to kind of unpack this comprehensive document, pull out the key insights for you.
That's absolutely right. This schedule, it really is the definitive standard for adult vaccination practice in the U.S. All the major medical groups endorse it. And it's based on the very latest science disease trends,
Yeah.
which is why you see it updated every year. It really reflects, our evolving understanding of how to best stay healthy.
So let's start right at the beginning. Who actually puts this, well, powerful guide together, and why is it considered so foundational?
Well, the heavy lifting, so to speak, is done by the Advisory Committee on Immunization Practices, the ACIP. They're a group of medical and public health experts, and they review all the data, clinical trials, safety monitoring, disease patterns, you name it. Then they make recommendations to the CDC,
Oh, okay.
and the CDC officially approves and publishes the schedule. Its importance: it gives a consistent, evidence-based framework for really every doctor, nurse, pharmacist across the country.
Mm-hmm.
Without it, care could get pretty fragmented. And it's not one size fits all. It uses this sort of dual approach.
Right.
You've got the foundational recommendations based on age for, the general population,
All right.
and specific recommendations tailored for individuals based on their unique health conditions, maybe their job or other life circumstances.
Okay, that makes sense. So it's not just about hitting a certain birthday then. But how does a healthcare provider actually use this guide? I mean, to figure out what someone like you listening might need, it looks pretty dense.
It can look complex at first, yeah, but there's definitely a process.
Hmm.
They typically start by looking at the age-based recommendations in Table 1. That covers what's generally recommended for adults in your age group, assuming you're not already immune or vaccinated.
Okay. Step one.
Then Step 2, they move to Table 2. This is where they assess your personal situation. Do you have specific medical conditions, like diabetes or heart disease? Are you pregnant? Maybe you're a healthcare worker or planning international travel. These factors might mean you need additional vaccines.
Got it.
And this is really crucial. They must dig into the detailed notes and appendices. That's where you find the essential info, like the number of doses needed, the exact timing between them, and critically, contraindications and precautions. Those are situations where a vaccine just shouldn't be given, or maybe needs to be delayed. So it's really a multi-step assessment. It requires a comprehensive look, not just a quick glance at a chart.
Right, right. I notice on the visual schedule there are different colors. What do those signify? And there's this category called shared clinical decision making. That
Yeah.
sounds different.
Yeah, the colors are basically a visual key in the legend. They show the strength or context of the recommendation.
Huh.
So you have routinely recommended, like the annual flu shot,
Okay.
then recommended just for specific risk factors. Then there's that recommended based on shared clinical decision-making category. And finally, areas where there just isn't specific guidance right now.
So what is that shared decision making part?
That's a really interesting evolution, actually. For certain vaccines, maybe like the RSV vaccine for adults age 60-74, the benefit-risk calculation might vary more depending on individual factors. Maybe even personal values or preferences come into play.
Ah, okay.
It basically recognizes that the decision involves a conversation between you and your doctor. You weigh the medical evidence together, considering your own circumstances and priorities. It's a more collaborative approach for some specific recommendations.
All right, let's get into some specifics then. What are some of the core vaccines recommended just based on age? Again, assuming you haven't had them or aren't already immune.
Sure. These are primarily listed in Table 1. Let's touch on a few that are, commonly recommended for most adults. Annual influenza vaccine, the flu shot, is recommended for everyone 19 and older. It's just a really important layer of protection each year.
And I think I heard something about an update for older adults specifically with the flu shot this year. Is that right?
Yes, exactly. That's a key change for 2025. For adults 65 and older, specific enhanced vaccines are now preferentially recommended. The reason is they tend to produce a stronger immune response, which is really beneficial as our immune systems age. So options like high-dose inactivated or recombinant or adjuvanted vaccines, those are the ones preferred for that age group.
Makes sense.
The 2025 schedule also reflects a shift towards recommending trivalent formulations, which aligns with what the FDA has approved based on, the circulating viral strains.
And timing. Still aim for the fall.
Ideally, yeah, September, October is best. But getting vaccinated later in the season is still beneficial if flu viruses are still spreading. Okay, then there's Tdap and TD. Everyone needs a single dose of Tdap at some point as an adult. That protects against tetanus, diphtheria, and pertussis, which is whooping cough.
Right.
After that one Tdap dose, you need a T booster, just tetanus and diphtheria every 10 years.
Why is that Tdap so important for adults, especially if maybe we got vaccines as kids?
Well, protection against pertussis, the P in Tdap, can wear off over time from those childhood shots. And there's a really crucial recommendation for pregnant people. A Tdap dose is needed during each pregnancy, ideally between 27 and 36 weeks.
Each one? Wow.
Yes, each pregnancy. It allows the pregnant person's body to create antibodies, which then get passed to the baby before birth. This gives the newborn vital protection against whooping cough during those very vulnerable first few months, before they can start their own vaccine series. It's a powerful way to protect infants.
That's fascinating. Okay, what else is on that age-based list?
MMR, that's measles, mumps, and rubella. If you were born in 1957 or later, and you don't have proof of immunity or prior vaccination, you'll likely need 1 or 2 doses.
Why the 1957 cutoff?
It's mainly because measles vaccination wasn't widespread before then, but also natural infection was very common, which provides immunity. So folks born before 57 are generally presumed immune. It's especially important to be protected if you're, say, a healthcare worker, an international traveler, or a woman of childbearing age who isn't currently pregnant. It is a live vaccine, though.
Meaning?
Meaning it's generally not given during pregnancy, and you should avoid getting pregnant for about a month after getting the shot. Similarly, for varicella, that's chickenpox, 2 doses are recommended for adults born in 1980 or later who lack immunity.
And the 1980 cutoff, same idea.
Sort of. It's because widespread childhood vaccination started later for chickenpox. So, many adults born since 1980 might not have had natural chickenpox or gotten the childhood vaccine series. So they likely need protection. There should be about 4 to 8 weeks between the 2 doses. And sometimes, if given quickly after exposure, it might help prevent or lessen the illness.
Okay. What about hepatitis B?
Right, Hep B. The recommendation now is for all adults aged 19 through 59. This is actually a significant public health strategy shift.
How so?
It's moving beyond just targeting high-risk groups to aiming for broader protection against chronic hepatitis B infection, which, can lead to really serious liver disease and even liver cancer down the road. For adults 60 and older, it's recommended if they have specific risk factors, or it falls into that shared clinical decision-making category, even if they don't have known risks.
And how is it given?
It's a series, either 2 or 3 doses, depending on the specific vaccine type used. And importantly, it is considered safe to get during pregnancy if needed. And finally, for shingles, the recombinant zoster vaccine, RZV, brand name Shingrix, is a 2-dose series recommended for everyone 50 and older.
Regardless of whether they've had shingles before.
Exactly. Regardless of prior shingles or even if they got the older shingles vaccine, Zostavax, years ago, the RZV is much more effective. It's also recommended for adults 19 and older who have immunocompromising conditions.
Okay, so that covers a lot of the general age recommendations from Table 1. But as you said, the schedule gets really specific based on individual circumstances in Table 2. Let's talk about some of those situations.
Definitely. This is where that personalized approach with your provider is absolutely key. Table 2 covers these specific indications. Pregnancy is a big one, as we touched on with Tdap, beyond getting Tdap during each pregnancy.
Right.
The 2025 schedule includes a recommendation for the RSV vaccine given seasonally, typically between 32 and 36 weeks of gestation.
That seems relatively new.
It is, in the last couple of years. The goal is to protect the infant from severe RSV infection during their first 6 months or so of life. It's another example of how maternal vaccination provides that crucial early protection for the baby. And of course, getting the annual flu shot and being up to date on COVID-19 vaccines is also advised during pregnancy. But it's also critical, as we mentioned, to know which vaccines are contraindicated, generally the live ones like MMR.
Makes sense. What about people who are immunocompromised?
That's another major category. If someone is immunocompromised due to a medical condition, maybe like HIV or certain medications like chemotherapy or high-dose steroids, their vaccine needs change significantly. Recommendations are often adjusted. For instance, that RZV shingles vaccine we just talked about. It's recommended for immunocompromised adults starting at age 19, not just 50.
Ah.
Pneumococcal vaccine guidance is particularly complex for this group. It really depends heavily on the specific condition and what vaccines they might have had before. Sometimes the Hib vaccine is needed for conditions like having no spleen or after a transplant, and additional COVID-19 doses are usually recommended too. The patient's specific immune status is really the driving factor there.
And what about common chronic medical conditions like diabetes or heart disease?
Yes, having many chronic conditions increases your risk of complications from vaccine-preventable diseases. So if you have conditions like diabetes, heart disease, lung disease like asthma or COPD, chronic liver disease or kidney disease, you likely need the pneumococcal vaccine.
And that connects back to the change we talked about earlier, right?
Yeah.
Lowering the general age.
Exactly. It's a really significant update for 2025. Pneumococcal vaccination is now universally recommended for all adults, 50 and older, down from 65, assuming they haven't had the appropriate vaccines before.
Why the change down to 50?
It reflects growing data showing a substantial burden of pneumococcal disease, like pneumonia and meningitis, in that 50 to 64 age group. Plus, we now have newer, more effective vaccines available, like PCV21, which was recently added. So it remains recommended for those 1949 with specific conditions, but the routine recommendation now starts at 50. It's a major step to expand protection earlier. Also, for chronic conditions, the annual flu shot is crucial for most people. And the RSV vaccine, using that shared decision-making approach, is recommended for adults 60-74 if they have certain chronic conditions like heart or lung disease. It really highlights how vaccination is a vital part of managing overall health when you have comorbidities.
Okay. What about healthcare workers?
Healthcare personnel, or HCP, have recommendations designed to protect both them and their often vulnerable patients. So being up to date on MMR, varicella, hepatitis B, and getting the annual flu shot are standard. A Tdap dose is needed if they haven't had one and have patient contact. Sometimes meningococcal vaccine is recommended, especially for lab staff working directly with the bacteria.
Anything new there?
Well, interestingly, the schedule specifically clarifies that Mpox vaccination is not routinely recommended just based on occupational risk in healthcare settings. It shows a really nuanced risk assessment, considering how that specific virus spreads in that environment.
Got it. And international travelers.
Travelers definitely need to think beyond the routine schedule. The first step is always to ensure your routine vaccines are current. Then, check the CDC's Travelers Health website. It's an excellent resource for destination-specific recommendations.
How far ahead should you do that?
Ideally, 4 to 6 weeks before your trip. That gives enough time for any needed vaccines to take effect. Depending on where you're going, this could include things like MMR, especially if traveling to an area with a measles outbreak, or potentially Mpox if going to certain areas with clade I outbreaks and anticipating high-risk activities. Even a booster dose of polio vaccine might be recommended for some destinations.
Wow, okay. So we've woven in a lot of the 2025 updates as we've gone along. But maybe stepping back for a second, what does the nature of these annual updates tell us? And were there any other really notable changes this year?
It really underscores that this schedule is a living document, completely driven by evidence. You see changes based on new vaccine approvals, like PCV21 for pneumococcal disease joining the options. You see refinements based on new safety data, like the update removing the Hepatitis B vaccine from the list of contraindications during pregnancy based on more recent information. Recommendations also evolve based on disease patterns and vaccine effectiveness data, like the refined RSV guidance for those different age subgroups, 60-74 versus 75-plus paid.
Right.
A really notable update this year, not tied specifically to one risk group, but reflecting a renewed vigilance, is that the inactivated poliovirus vaccine, or IPV, has been added back into the main tables.
Added back. What?
It's now listed as a routine recommendation for adults who are known to be incompletely vaccinated against polio. This seems to be a response to the challenges global polio eradication efforts are facing in some parts of the world. It just reinforces the need for robust population immunity here in the U.S. as well. And besides these big changes, there are always general clarifications, harmonized language in the notes section, all aimed at making the guidance clearer and more usable for healthcare providers. It's a constant cycle of review, data analysis, and refinement.
All this detail really makes it clear this is far from just a simple checklist. So zooming out again, what are the broader benefits? Why is adult immunization so fundamentally important?
Well, the benefits are really twofold. There's the individual protection and then the community protection. For you personally, vaccines work by training your immune system to recognize and fight off specific diseases before you get seriously ill. They don't just prevent the illness itself, they significantly cut down your risk of severe disease, hospitalization, maybe even death, and those potential long-term complications.
Can you give some examples?
Sure. Getting your flu shot can lower your risk of flu-related pneumonia, or even heart attack or stroke, which can be triggered by the flu. The Hep B vaccine prevents chronic infection that can lead to liver cancer years later. The HPV vaccine prevents several types of cancer caused by that virus. It's really about preventing serious outcomes. And then, from a community perspective, when enough people are vaccinated, it creates what we call herd immunity or community immunity.
Right, I've heard that term.
It basically makes it much harder for diseases to spread through the population. This offers a crucial layer of protection for the most vulnerable among us: infants too young to be fully vaccinated, elderly people whose immune systems might be weaker, people undergoing cancer treatment, for example. So your decision to get vaccinated really does have a positive ripple effect throughout the community.
Okay, that makes a lot of sense. Let's shift to the practical side for a minute. Getting vaccinated, what should someone expect? What are some general, nuts and bolts to keep in mind?
Right. Well, first, the dosing schedules and intervals vary a lot. You've got the annual flu shot, the TEADS booster every 10 years, and then multi-dose series like Hep B or varicella or RZV that are spaced out over weeks or months. Following those minimum intervals between doses for the multi-dose vaccines is really essential for building up adequate immunity.
So keeping track is important.
Absolutely. Which we'll come back to. Another practical point is co-administration. Generally, it's safe and actually recommended to get multiple vaccines during the same visit.
Really? Like more than one shot at once?
Yes, usually just in different sites, like one in each arm or maybe different spots on the same arm. It's encouraged because it helps ensure people get all the vaccines they need without having to make multiple trips back. It avoids missed opportunities.
So like your flu shot and maybe a pneumonia shot together?
Exactly. Or the RZV shingles vaccine and a COVID-19 shot. The main exception is you need two live vaccines, like MMR and varicella. If they aren't given on the exact same day, you typically need to wait at least 4 weeks between them.
Okay. What else should people be aware of?
It is absolutely critical for both you and your provider to review the contraindications and precautions before any vaccination. These are detailed in those notes we talked about. A severe allergic reaction to a previous dose or a known component of the vaccine is usually a clear contraindication, meaning you shouldn't get it. Precautions are situations where you might need to delay vaccination. Maybe you have a moderate or severe acute illness at the moment. Or, as we discussed, avoiding live vaccines during pregnancy. Another example from the new schedule. If you currently have shingles, you should wait until the rash resolves before getting the RZV vaccine.
Good to know.
And for ongoing safety monitoring, any clinically significant adverse events that happen after vaccination should be reported to VAERSAS. That's the Vaccine Adverse Event Reporting System. It's a vital part of our public health surveillance system, helps track any potential issues.
And you mentioned keeping track.
Yes. Finally, and this is honestly a huge challenge in adult healthcare, maintaining your own personal immunization record is incredibly important. Unlike with kids, adult vaccine records can be scattered across different doctor's offices, clinics, pharmacies, sometimes even different states over the years.
Yeah, I can see that being a problem.
It really can be. Having your own accurate record ensures you get the right vaccines at the right time, helps you avoid getting unnecessary repeat doses, and it's absolutely crucial information if you have a medical emergency or when you change healthcare providers. It really highlights the need for all of us as adults to be active participants in managing our own health information. Because this schedule, as we've seen, is evidence-driven, it's constantly updated, and staying informed and keeping track is key for both providers and for you.
So we've really taken a deep dive into the 2025 CDC-AP adult immunization schedule. We've looked at the age-based basics, how specific health factors or situations trigger other recommendations, and the importance of staying informed about the latest updates, like that significant change lowering the pneumococcal recommendation age to 50, or the re-emphasis on IPV for some adults. It's clearly a sophisticated tool aimed at personalized health protection.
Absolutely. And staying up to date with the vaccines recommended for you is just a fundamental piece of maintaining your personal health. It also makes a really significant contribution to the health of your entire community. It really requires that ongoing conversation with your healthcare provider, using this official guidance as the foundation for those decisions.
Definitely. So here's something to think about. Given how tailored these recommendations are becoming to individual health histories and how frequently the guidance gets updated based on new science and data, how does understanding this whole process maybe change the way you think about managing your own health information and staying proactive about your preventive care moving forward?